Yeah. Right leg, ankle pain.
Good evening, everyone. Just few 2 minutes. There is something wrong with the slide share.
This meeting is being recorded.
Are you able to see this is screen?
Yes, sir.
No, but the PPT is seen or not? Now, PPT is seen.
Yes, sir.
Yes, sir.
Can somebody read the heading, please? Hello?
Challenges in healthcare supply chains.
Fair. So today's chapter will be covering challenges in healthcare supply chains as well as change management. So, as you know, previously we have seen some of the models in supply chain management. We now see the practical possibilities of case studies in supply chains. So, the first challenge which the healthcare industry faces is timely delivery of drugs. Okay, some of the drugs get delayed, or they are in process, or they are not yet delivered in the town or the city. And second challenge will be that of equipment, which also take lag time in order to get delivered. So these factors like demand uncertainty is also there, and supply shortages are also there. In some cases, they're not as much in volume as much as required, as much as basic things like supply of even the requirements of tissues or disposables or usables. So consumables, all this asserts a lot of cost pressure. So this is another complex challenge which the healthcare industry faces, and the management of all these things becomes critical. The case in point, most of us might have already seen is COVID-19. Many Indian hospitals faced oxygen cylinders critical shortage. So oxygens had to be brought, and they had to be transferred in various bulk tankers, and then it was transferred to cylinders. So this is case in point, which is one of the challenges which was faced during a pandemic. So this the second challenge being the demand uncertainty. People don't know how much the patients are going to buy. So we don't know in advance that whether what is the estimate, what is the exact range of purchases required on a daily basis because of the very nature of the industry itself. Because during certain seasonal spikes, one has to be very accurate in order to do a lot of accurate predicting, but during pandemics and emergencies kind of situation or any disasters, in those cases, it becomes the demand becomes uncertain. There may be too many units of equipments and consumables and disposables, as well as medicines and drugs, which is in short supply. The case is the Fortis Hospital reported a 200% rise in oxygen demand during the Delta wave. So the second COVID SARS and Delta wave which came, it required 200% rise in oxygen cylinders. So they did not know that they had to meet such a demand for procurement, and they had to forego the protocols. Sometimes the set protocols have to be broken, and they have to find mutual understanding between various companies in order to cater to the demands. The third challenge could be supply shortages and stockouts also. So, caused by the global manufacturing disruptions over a period of time, certain countries exert a lot of pressure in order to get those supplies towards their own country, leaving behind some other countries who are not well to do in order to purchase them. So, there are limited suppliers in certain countries, which forces them to buy substandard equipments and substandard drugs. Also, sometimes alternative drugs or equivalent drugs, or sometimes generic drugs. So, all these poses a huge challenge for the healthcare industry. The example is AIMS Delhi tackled PPE shortages, the personal protective gear which equipment which the doctors wear. That was in shortage in AIMS Delhi, and through local vendor tie-ups, they had to develop the internal production, and the companies were working day and night in order to create and make those manufactured of PPE wearable, vests and jackets. Uh, Another kind of challenge could be in terms of the lack of technology integration. People may not be aware that they may have to equip themselves with the training of technology, and because of which there is poor visibility and a lot of human errors happening in this industry. The testimonial after this could be seen in terms of adaptation of ERP systems, in case of RFID tracking systems, which have been adopted in most of the hospitals now. But we have seen it could reduce the stock losses by 30%. So this adoption of ERP, enterprise resource planning, and RFID, that is radio frequency identification, which will help to eliminate the stock losses by around 30%. Supply chain manager Apollo Hospitals has been able to comment on this. Then there could be another set of challenges in terms of the high cost pressures. Hospitals balance operational costs because sometimes the cost goes beyond the budget, and they may not be able to comply with the regulations. So it becomes a burden on the regulatory compliance as well. So cost pressures are there, because of which it affects certain regulatory requirements, which is beyond the budget of the hospitals. The mini case which we can present could be that of Narayana Health, which implemented the bulk procurement and they were able to save around 2 crore annually. So people have to be wary about not only the shortages, but also they have to manage the cost pressures. And in case if the technology is working well, they are going to implement, and can overcome the burdens of failing shortages in terms of equipments as well as medicines and drugs. And moreover, uh, the kind of industry which the healthcare is, there are so many regulatory bodies to which the hospital becomes answerable and held accountable. NABH is there, CDC, SEO is there, FDA is there. So there may be other regulatory agencies depending upon the requirement of various types of hospitals, which they need experts in order to contribute and comply with all the requirements and fulfill as per the standards. So compliance becomes a little bit of challenge in case if they do not have the skilled staff. So case in example is a tertiary case hospital in Pune faced audit penalties. So in case if they're not able to comply with, then there are penalties which they'll have to pay due to the delayed supplier certification, because they have to purchase from suppliers who are already certified. They cannot buy offhand from any supplier, because of which they may be penalized heavily. So in this case, certification also matters, and regulatory compliances have to be scheduled as per the requirements of the standards which they are following. One or two standards also makes a huge lot of difference for the, because in the end, the customer or the patient is going to see what kind of certifications do they have, what kind of standardization is in place in the hospital in before using the such facilities. So that comes in with its own kind of complications and complexities. Then there is issue of cold chain management, so which is very essential for storage of blood, and there could be a very highly investment oriented, highly capital intensive blood banks and vaccine banks, which has to be taken care of with a lot of nurture and conditioning, which also comes bearing upon who is going to bear all such costs for keeping heavy blood banks. That's why people rely on the third party blood banks in smaller hospitals. They may not have their own blood banks. Only the larger hospitals may have. In case of vaccines also, it depends upon, sometimes vaccines have to be imported depending upon whether it is made outside in some certain restrictions, unless they are certified and popularly met. The case in study is Manipal hospitals, which installed the GPS enabled cold storage trucks. So we know due to the GPS where the truck has moved and from which point to which point they are able to distribute, and it helped them to prevent 95% of the spoilage incidents. So technology is also required during transportation. Cold chain management requires not only temperature, pressure controls, but also movement of goods from one place to another place. So cold chain is an essential condition, especially in tropical countries like India, whereby climatic conditions will not guarantee the success of all the things which is being stored in cold areas. Then comes the multiple stakeholders. So there are many people who are involved in the supply chains, and which another even the government agencies are involved, like private agencies, vendors, logistics intermediaries are involved. So all these people have to work, coordinate too much. So it requires too much of coordination, which may not be available in every state. Certain states are good in coordination, cooperation. For instance, during the Kerala floods, the coordination between private hospitals and the state health department ensured the continuity of critical care supplies. So all states are not that fortunate to have good coordination between all the stakeholders, including the government agencies and logistics providers and vendors. So because of multiple stakeholders, the coordination between the compliance and compatibility of the softwares, and as well as whatever give and take, handover and take over for all the required medicines, becomes a another posing challenge. Then comes the emergency preparedness. So this is uh, challenge which every hospital normally faces due to the issues of agility. So there is an always a requirement of agility, flexibility in terms of meeting the deadlines and meeting the targets during the crises. So in the case of Cyclone Fani, and IIM's Bhubaneswar maintained emergency buffer stock ensuring the uninterrupted ICU operations. So nowadays they are gearing up. There are agencies which are prepared, showing preparedness in order to handle such things. But everything cannot be done by a single organization. It has to have a lot of coordination, cooperation for emergency preparedness. So there could be disaster management cells, there could be local municipality, there could be health departments and health ministry, both from the center and the state, who have to take care of cyclones and hurricanes and all such things, floods, especially in certain regions. Then comes the overcoming supply chain challenges. How we can address to all these changing things. First is to be adaptive in terms of digital systems. The latest of the digital systems have to be adopted by the hospital, and they can diversify the vendors. Instead of buying from one vendor, they can go for multiple vendors and strengthen the emergency planning and improve the interdepartmental coordination. So it requires a lot of training, support from the top management, shows that each and every time certain briefing and debriefing sessions, regular meetings upon the emergency planning comes in handy when the coming such supply chain challenges are posing hindrances in terms of uh, meeting requirements. Then another challenge could be the cost concepts, because understanding the cost itself takes a huge lot of time. Because in order to understand, it requires optimization of budget according to the increased price structures, or differences in tax structures, and pricing becomes sort of hectic scheduling on a day-to-day basis. For instance, Apollo hospitals are able to do something good because of the cost audit, which identified 15% of savings through energy efficiency program. So, Apollo hospitals have started their own energy efficiency programs. They are using energy from various sources, so they are able to use, um, at least by reducing the cost, which was found out in their audit. So such kind of examples one can come across in our day-to-day lives in terms of how some hospitals are good in equipment, some are good in cost saving, some are good in expertise, and some are able to handle the pandemic. Some were identified as COVID hospital during such times, and some have the wherewithal to invest heavily in terms of resources and the utilization of cold storage areas and managing the supply chain smoothly. Then comes our fixed and variable costs. So fixed cost, as we all know, rent is a fixed cost, administration salaries is a fixed cost, and variable cost would be consumables and drugs. So we since it could keep on fluctuating, we do not know the exact number of consumables and drugs on an ongoing basis. So it requires a lot of just-in-time kind of a model in order to handle them. So many cases could be a multi-specialty hospital in Chennai achieved cost control by outsourcing the laundry services. So there was a lot of laundry requirements over a period of time. So they had to manage the cost. In order to do that, they had to outsource the laundry. And then there could be direct and indirect costs involved. So surgeon fees are there because most of them are honorary or visiting surgeons, so they require test kits. There could be indirect charges which are levied for every operation. There is separate charge for consultation, separate charge for surgeries, separate charge for utility of those kits, and the housekeeping will also be involved in some kind of indirect cost. So example is St. John's Hospital supplied activity based costing. So based upon the activity, costing is being done to trace the indirect overheads more precisely, which will give the overall requirements for budgeting. Then there could be controllable and uncontrollable costs. So over time, consumables are there which are controllable. We can know how many consumables can be bought, but what is beyond our capacity to understand over a bit of time could be taxes, loans if it is taken, interest which is derived. So taxes, loans, and interest is something out of our means the exterior forces will determine how much of things are likely to make it towards profits. And the testimonial is tracking controllable cost improve healthcare. That's what Narayana Health says. They were able to save by around 8% by managing their controllable costs. Then opportunity as sunk costs. We know the opportunity cost. Most of us, if you go for one particular methodology, if you have to let go of another method, so that is known as opportunity cost. And sometimes benefit has to be foregone. And sunk cost is past expenditure, something which has not been handled previously as a part of the costing. So sunk cost is past expenditure which is already spent on a particular project. So it is a sunk cost. So there are two costs involved: opportunity and sunk costs. The best in case point example would be the Bangalore hospital opted for digital patient records or physical archives. So to say the long-term space and retrieval costs. So instead of having areas for storing all the files, they shifted onto the digital space. They can store a lot of data and files. So in order to maintain a heavy number of documentation, these kind of costs also matter a lot. Then comes the cost analysis and management, involves the cost benefit and cost effectiveness and cost utility. So hospitals, since it is also one of the main requirements of utility, there have to be three different ways of analyzing the costs. So not just the benefit out of what they are deriving from the cost. So it could be cost benefit analysis. It's a cost effective analysis as well alongside, and the third one is cost utility analysis. So the same thing could have to be analyzed in three different ways. The best in case example was Apollo's vaccination program, which they had taken, which saved nearly 1.2 crore rupees versus the hospitalizing cost through preventive approach. So we don't know at what stage the hospital enters into the project. It could be preventive, or it could be reactive, or it could be regularly frequent kind of vaccination. Periodic vaccinations are there. So cost analysis becomes more meaningful if they know what kind of costing is there. Is it for the benefit? Is it for the effectiveness of the entire program or the project, or it is only for the utility analysis? So depending upon the scenario in which the entire exercise is undertaken, they will have to understand what kind of a savings they can end up with. And then we know as budgeting and variance analysis. So budgeting also, they have to align with a lot of spending which is in focus for the forthcoming quarter or second part of the year or third part of the year. So accordingly, variance analysis also has to be done, whether the costs are going to be likely to increase depending upon various external factors as well as internal factors. And accordingly, they have to detect the inefficiencies. So once you detect the inefficiencies, action has to be taken. For example, Fortis used variance analysis to control the pharmacy wastage. So there's a lot of wastage happening, and there's a lot of it goes into the dumps. So in order to reduce such wastages, they have to carry out the variance analysis over a period of time, month by month, or every quarter. So they are able to identify where exactly most of the wastages are going, and which specific commodity or the item or the units is getting wasted, and why. So it requires detection of such inefficiencies. Then there could be activity based costing and benchmarking. So as we all know that already, we have seen that in activity cost, Narayana Health has been introduced. Similarly, it allocates by each activity. Even if you see the some of the bills which are raised against the patients, we will see a lot of activity based costing, because for a little bit of any kind of operations, we'll see all the number of costs which are hidden costs, or anything has to be more transparent. The more meaningful it will be in case if they are going to compare themselves with the best benchmarking system. So benchmarking is very important as to what all has to be mentioned in the bill. Sometimes hidden costs are not mentioned, and then the end patient comes to know that some of the costs which he never knew has been incurred now. So it should be very transparent in the beginning only. So what is required, how much is this going to cost, all those things. So based upon each activity, there should be transparent mechanism of give and take. The transaction has to be made upon certain procedural requirement or standard operating procedures. So what Narayana Health has been able to maintain is our ABC model. So how we have already seen A is very highly valued items, B are moderately value, and C are little lesser value. So ABC model has been able to help them in order to rationalize the pricing by around 10%. So that's what Narayana Health Financial Controller says. Next comes financial performance metrics. One, what they keep on measuring is our operating margin, how much of profits of during operating margin they are able to gain or yield. And second, obviously, could be the net profit. And the third is the current ratio and the debt to equity ratio. So all these key matrices also, just like various other industries of service which are involved in service, these metrics also are used in order to maintain the balance between whether everything is going successful or it's a loss making unit or it's going to make meaningful profits. The operating margin, net profit, current ratio, debt to equity are the normal matrices which are being used. The case in study example would be a private hospital in Hyderabad improved liquidity ratio from 0.8 to 1.3 via cash flow reforms. So they were able to maintain a lot of cash, and the cash flow was improved from 0.8 to 1.3. So that's how measuring these ratios and performance, current ratio, debt to equity ratio, net profit, and operating margin also all make them improve their liquidity status. Then we'll see a little bit of future trends in healthcare supply chains. As we all know that this is the age where slowly the technicalities are being slowly changing. Artificial intelligence has been the call of the day. Blockchain implementation is also there for better assurance of transactions, and then tracking uh, is being taken care by IoT, Internet of Things, and green supply chains, as far as giving back to the environment is concerned. All these things, concepts, have often suddenly evolved over a period of time, rather, but then when we study all these things come at the same time. So AI, blockchain, IoT, green supply chains have been a defining stage in which how entire organizations are being managed is going to change into the future. So the future has to have these kind of measurements also in terms of taking care of the supply chains. Best in case example would be Aster DM Health uses AI forecasting tools. They are already starting using AI forecasting tools, reducing the stocks by 20%. Stockouts means once we, in case of dire circumstances when the things are not there. So AI helps them to balance the stock instead of exposing the hospital to understocks or overstocks or stockouts. So that they have reduced the stockout scenarios by 20%. Artificial intelligence and predictive analytics has also been able to prevent shortages and able to predict accurately in terms of how much of things are required, how many drugs, how much of equipment, how many flow of people and patients are there. So all these helps in order to have protective gear. So in case of NHS UK, National Health Service United Kingdom, automated their demand prediction, and they use it for PPE, the protection PPE gear, wearing those jackets and vests for using the by using the algorithms. AI algorithms have been used in order to understand the production requirements for the future. So similarly, blockchain and IoT integration, blockchain ensures the traceability. So wherever the transaction is going missing some way, there's a lot of disconnect between various groups of organizations. So blockchain helps you to keep a track of where the transaction has started, where it is ending. So it helps you to stay unified in terms of understanding where the transaction began, where it is going to end, how many times it has been taxed, how many are the stakeholders who all have tracked the transaction and who all have been able to work upon that. So blockchain helps you in traceability. IoT, Internet of Things, improves the visibility. So that also is helping a lot in order to overcome the barriers. So case in point is Apollo's IoT enabled fleet. Okay, for all the fleets, Apollo is having the IoT nowadays, so they have been able to reduce the delivery delays by around 15%. That's why Apollo, you'll see all the places. They're able to move the things faster than other pharmacy providers and suppliers, and even hospitals. Then green and sustainable practices. So this challenge can be overcome by having the eco-friendly packaging and energy optimization. So instead of just the uh, energy which is hydroelectric energy, you can use wind energy in certain places where wind is there. Then solar energy is there. Then there could be nuclear energy. There could be various forms of energy so utilization. So this will help environment to regain balances than exploiting the fossil resources. So eco-friendly packaging and energy optimization is there. Example is Fortis hospitals. You adopted reusable surgical kits. So sometimes, although it is unhygienic practice, but somehow they have been able to evolve by using reusing the surgical kits, cutting the waste by 25%. Then, most importantly, resilience and risk management. So, always the hospital needs to keep the buffer stock in place. If they build the buffer stocks, then there could be it could be done by identifying the multiple source suppliers. If buffer stock is there with them, with all these drugs as well as equipment, they are able to manage. The case in point is MGM Healthcare, which has been diversified across the supply across various states with a lot of suppliers which are there in every state, improving the stability. Then integration with HIS and workforce upskilling. So overall, the hospitality information systems has to evolve and enable the predictive stock control over the entire set of issues. So they should be able to have a workable nature in which predictive stock control can be done. It requires a lot of upskilling, and upskilling the staff helps to reach such readiness. So we have seen this here that healthcare management demands cost control on one hand, not only cost control, but it requires technical adaptation on another hand, along with support from the financial background in terms of managing the costs as well as the sales very well and budgetary requirements. So all the three angles, if you see technology, finance, as well as um, handling the flow of people, it requires that we can comply with the standards. So what we see is every rupee saved through better supply chain is a life better cared for. So because the money which is saved through all these things obviously is going to be used for the betterment of hospital, and over a period of time, the better the hospital is, the better it will be in a position to take care of the patient's safety, and it will be long lasting, and in the image as a good hospital, in the image of the public. That's what healthcare administrator says in case of Manipal hospitals. That's how it's what we have seen was about challenges. Now we will from challenges we'll now go to a little bit of change management, which a part of which change management has been dealt previously, but not entirely. So change management is a newer issue which has evolved over a period of time. Apart from facing the challenges, what hospitals can be doing is managing the change. Just give me a minute. Yeah. So as we all know, change management has become a subject over a period of time. So change management enables hospitals to adapt evolving technologies, patient expectations, and regulations. Okay, so along with the adaptive nature of the upcoming regulations, we also be evolving our technologies and also the what patient is expecting from such kind of a scene. So the best in case example obviously would be The latest one is COVID-19 pandemic, where Apollo hospitals swiftly transitioned to teleconsultation services across 70% of the departments. The problem with the private hospital as of now, it's very expensive for the common man to afford this kind of teleconsultation. So even the government has pitched in its support in terms of teleconsultation, which reduces the enormity of charges which is required. And as a responsibility, the government will also do the teleconsultations, which reduces the consultation fees over a period of time. So patient expectations have been met, not only the private parties, but also, of course, by the government departments. So another change which has happened is defining a structured approach to transitioning from a current to a desired state. That's what change management is all about. So, uh, where we are as of now and where we want to be in the future, what is going to happen with the hospitals in the next 5 years, all that matters is the structure. We should have some kind of structured approach in order to meet the current demand. So, change management in such a context is nothing but handling the situation very carefully. The goal is to preserve the care of quality while enhancing the efficiency. In certain cases, just because people are improving the efficiency, the quality is laid back, and it gets back seat in terms of maintaining the desired quality. But both are important. Not only efficiency of the entire services, but also the quality with which it is offered, the care is offered. Both are equally important. So testimonial is effective change isn't about new systems, so it's about empowering the people. So Narana Health has is good in managing the HR. They have a good policy in order to empower the people. So some hospitals are over concentrating upon efficiency and targets. Some other hospitals may be good in managing the people, but it requires a balance of managing people on one hand and all the systems on another hand. People and systems will take care of the rest of the organization's betterment. So change is required from both uh, the facets and both the perspectives of managing people on one hand and all the systems on another hand. Systems include not only computer systems, systems include all kind of processes and flows of work in every department. So what drive these changes is, the first is uh, whatever recent changes is happening in the science field, it obviously going to affect the healthcare industry also. Like what we have seen is AI adoption of AI, employee health records, using robotics in certain cases. As we've seen, robotics have been increasingly used for operations and moving of things from one place to another place, because there could be dire shortage of people in certain cases, because there's a lot of demand of people. People move from one place to another place because of better prospects and improved condition of expertise, and because of gaining a lot of experiences. So we cannot entirely rely on human skills. So that's why robotics is also being undertaken in terms of technological advances and help, which is catered for the healthcare services. Then change is also due to the regulatory reforms. NABH laws are there, HIPAA laws are there, and they also keep on changing. And with the changing needs of regulations, hospitals will also evolve according to those set standards. Then the lot of expectations from the patients themselves, depending upon the average age of the people in certain countries. In certain countries, the average is increasing. In certain countries, very youngsters are there. So we have the patient different set of expectations in different countries. That also is driving the change in healthcare industry. Then we do have the workforce dynamics and burnout. As well, all know that in larger cities, in order to make the work-life balance, it takes a lot of workforce dynamics. It requires a lot of resilience, and people have to keep themselves stable, studying, and going ahead with work-life balance, and to reduce the burnout over a period of time. And that is what is driving the change in healthcare sector. Then we have some kind of global warming issues, or heat waves, or sudden cold waves, or rainy seasons. So global crises are opening whenever there's a melting of Arctic, you know, poles at the thing, when certain new kind of pandemics are evolving. because of melting of ice and all those things. So global crisis because of radiations and global warming and other things like these pandemics and all those things between different countries. It is causing a lot of change, uh, probably in a negative way, most often than the rest of the things which are all positive here. So, can say that these are the things which are driving the change. Then, case is Fortis Healthcare adopted the artificial intelligence in terms of the radiology analysis, and which is used especially after the post pandemic to meet the diagnostic demand. So certain hospitals are evolving, adopting newer technologies. Certain are complying heavily, and certain are getting good feedback from the customers. Because patients are expectations are also increased over a period of time in order to meet the uh, requirements of how care has been provided to them. And at the same time, burnout of certain employees increasing because of understaffing or certain issues of a lot of attrition happening. So people move from one place to another place, and this is kind of drivers which are changing at the global level. Then we got principles of effective change. Okay, first is one should have at least the promoter or the chairman and managing director or the owner. He should have a clear vision. Okay, only then things could move. Then there should be good leadership. Then it could be democratic leadership, it could be autocratic leadership, it could be servant leadership. So no matter what kind of leadership they have, the autocratic, democratic, servant leadership, all those things, they should know what they are in the first place. So that is most important. They should know what part of the world they are working, what kind of requirements the people have. So it calls for a clear leadership also. So not only clear vision but clear leadership. And then comes your stakeholder engagement. So you should know where the hospital is. It's very much within the city and within the society. They are not isolated somewhere in the sky. So stakeholder engagement becomes important. Who all uh, are really taking part in decision making, and on the shop floor kind of a thing, what on the hospitals, ECU, wherever, pharmacy, and so we should know who are the real stakeholders, to whom the decision making has to be enabled and allowed, what are the rights and regulations, what are the guidelines which have to be met. All these things could be decided on a day-to-day basis, briefing and debriefing. So stakeholder engagement becomes too uh, and a required principle which has to be followed. The third next principle would be everything should be transparent as much as possible. Nothing should be opaque, and transparent communication helps you to overcome the barriers of any misunderstandings and conflicts arising between two groups of people. Then training and support, most often neglected in certain hospitals, or sometimes there's only one trainer throughout three to four certain chain of hospitals. So training and support should be supported from the top, and it should be catered for. Then comes our finally the measurement and the feedback. So uh, during these kind of changes happening, as we all seen, the lot of change in terms of the feedback, the way in which it is processed, the way in which it is analyzed, how the analytics have been managed, has changed a lot over a period of 10 years nowadays. So measurement and taking feedback on what basis feedback is given and how it is measured and analyzed and how it is used for decision making, all these principles have become more, you can call, valuable. So example is NHS, National Health Service England's digital maturity program involve all clinical teams in design workshops. So this design thinking, what they call. So design thinking is evolving as a slowly as a part of our curriculum. So workshops are being conducted on design thinking. So even the NHS England also happened to come across the digital maturity programs involved in all clinical teams in design workshops to ensure the adoption. Then comes our challenges in implementing change. The very first of all, in emerging markets, we all know that there is a staff resistance, and there are hierarchical silos. The file moves from one hierarchy to another hierarchy. It takes a lot of time. a lot of disagreements, confusion in terms of various levels to whom to report to, what has to be reported to. So these are another kind of challenges which people might face in certain emerging conditions, countries. Then we have the resource constraints. Obviously, all resources are not 100%. So one has to work with limited resources, be it man, material, machine, manpower, whatever it is. So there are constraints within which, uh, while managing and implementing the change, we might not have the money at times. We may not have the exact manpower as much as required. We may shortfall of skilled labor, or we may face burdens in terms of excessive compliance, regulatory regulations. So all this leads to change fatigue. I mean, people are fed up with a lot of change happening at the same time. So things should work slowly in such conditions, and staff resistance should overcome by slowly empowering them, and hierarchical silos can be rectified by meeting often and coming with solutions on a day-to-day basis, or having some kind of complementary software like Slack. Slack is one software which is being used widely nowadays. Well, all of them should know the same thing in the same platform, in the same organization. So people need not have to worry about communication disconnect between various hierarchical levels. So resource constraints obviously cannot be easily eradicated. Resource constraints is going to stay whichever country you're working in. Change fatigue, obviously one has to come across challenges. Well, these are some of the challenges which we have already seen in the first part of today's lecture, but challenges alongside are also coming while implementing such a change, so one has to be really careful about all these things. So many cases AIMS Delhi's EHR implementation faced initial resistance until peer mentors were introduced to train clinicians. So that's kind of problems we encounter with. And then strategies for successful change. So despite the challenges, all that what we can do is to be ready with all kind of situations. So conduct the readiness assessments, empower the change agents, then celebrate the early wins. Then any kind of wins you get early, you have to celebrate them. You cannot leave them, because everybody should know how much of contribution a person is giving. So empowering is not that easy, but of course we have to celebrate for every gain or every wins which we are coming across. Then provide the psychological support. So motivation is something which is very becoming very dear and not easily available. So motivation and psychological support is all what is needed for the entire team working in healthcare sector, which people should be able to provide to others, and that's what has to be learned. And so many lessons have to be learned in terms of psychological support and mutual give and take, then embed change in the culture. So that is what is essential at this point on time. So, who has been able to champion all this is Manipal Hospitals created change champions to lead department level digital shifts. So, one can think of strategies for successful change over a period of time, and the only time can tell which hospitals can gain by encouraging a lot of change agents. So, empowering change agent need not be somebody who's trained officially. Change agents could be informally celebrated every often, that who has contributed the most for the betterment of the organization. So empowering change is nothing rigid about it, nothing to be overpowering somebody or something like that. Change agents is somebody who can inculcate values of change, who knows how to go ahead in the field of healthcare sector. So strategies for successful change is going to make things more easier in case of more leaders who are going to adopt change becomes successful. And then comes anticipating change in healthcare. So we have anticipated a lot of things, but they have to stay proactive at all the times. They cannot be reactive just because somebody else is telling us we cannot change. It has to come from within. The case in point is Narayana Health predicted the need for remote ICUs. So something like that was not was unheard before this. They came up with a new unique concept known as the remote ICUs. Okay, then they established these tele ICUs uh, pre-pandemically. Before the pandemic happened, this of course tele-ICUs have been there, but not suddenly. Means it became the mission and vision in order to cater to the required patients. So ICUs, remote ICUs, and tele ICUs enlarged over a period of time, and they helped for the faster national response. So all that change, what we have been able to see is little bit of complex, where one has to head to, how the decision making has to, who has to take the decisions, comes with a lot of imagination and anticipation and proactive commitment towards which direction one has to follow, given the complexity of the issues at hand. So anticipation improves the patient outcomes. It helps us to imagine a lot of things beforehand and ensures compliances and also reduce costs and builds the resilience. So that's why anticipation matters, even much before it happens. So all these strategies, plan A, plan B, have to be kept ready by the hospital, and the preparedness has to be there with every hospital, which has been the management directives, and the directors are also like CEOs of Fortis hospitals. They say preparedness is the new efficiency. Always the hospital has to be prepared for any unforeseen circumstances in the future. That kind of preparedness, at least you should have goal, direction, mission, vision, objectives. So once they can build a lot of resilience, and people can anticipate what's going to happen. Once you compare anticipation in the West, we have surpassed, because we have been able to manage the pandemic very well in terms of knowing our own demand, no matter how much large our population is. But then anticipation makes a huge lot of difference in order to handle how things go better than turning worse. So, what are key areas requiring anticipation? Is the first is technological innovation nowadays. The second one, patient demographics. So, what is the age? What kind of language do they speak? Whether they require a different way of approaching in terms of elderly people or the newly born infants, or patient demographics in a particular area has to be known. Then the public health trends happening in a particular city makes a huge lot of difference, how to anticipate what. And then policy and regulation, what kind of regulations the hospital is adopting, how, what kind of policy they're adopting. These are some of the hints or the guidelines of it. It can be indications of what anticipation could revolve around, and it could revolve around, of course, obviously, around the workforce planning. So having said this workforce planning and all those things, what government hospital, like including the AIMS, anticipated staff shortages. They came to know that there is going to be a staff shortage and initiated a nurse upskilling program in 2021. So because of which they are able to understand that there is problem with the workforce planning itself, because they knew that they are unable to meet those shortages, and they started initiating the upskilling programs. Okay, so nurse upskilling programs was being handled by them in 2021. So these are some of the areas of how technology has to be slowly evolving, how to be adopted, how patient demographics has to be comprehended, how public health trends are going in a particular place, then what kind of policy and regulation changes are happening, and how do we adopt and know it in the first place, how to read them in during practice for any practitioner, and workforce planning. Then how it has to be done, all these things. So first of all, environmental scanning, the current environment, the macroeconomic environment, or you can call the social environment, environmental, and so we call now steep analysis. We call it social, technological, economic, environmental, political environments. So environment could be directly, you can define steep environment, that is social, technical, environmental, economic, and political. So environmental has scanning has to be done in the first place. Okay, then once you do the environmental scanning, that is for, of course, from for the external factors. For the internal factors, we have to do SWOT analysis. What is the strength of the organization, in how way, in what way the organization is good, in what way the organization is weak, what are the opportunities the organization is going to face in the future, and what are the threats it's likely to face. So SWOT analysis is something what one has to do in order to know what other changes can be in the future. Then scenario planning. So scenario planning is something what one has to do all the time. There is, you cannot say that scenario planning happens only in the month of January, or it happens in the month of June or something. So scenario planning has to be dealt with upcoming, anticipating changes happening in the outside environmental scanning. So based upon environmental scanning only, you have to do the scenario planning. It cannot be the other way around. So it has to start with environmental scanning. One should know at the organization level what is SWOT analysis is all about. Then what are strengths, weaknesses of the threat. Then afterwards, obviously, the scenario planning has to be done. Then comes your using of technology for predictive analytics. So every now and then we know analytics is also there on our WhatsApp or Chat GPT or your Instagram and Facebook. Everything comes up with its own analytics. Similarly, whatever applications is used in your particular organization, predictive analytics has to be chosen. Every now and then you have to keep on tracking what's going right, what's going wrong, what are the possible hindrances which you're going to face, and what are the best practices and benchmarking in the industry in which you're working for a particular role in which you are going to play. So you should always verify and cross check with what are the type of benchmarking is happening. So that's how we can equip ourselves with the tools of anticipating change. The best in case point is about Apollo. Since Apollo used predictive analytics to anticipate oxygen demand. Okay, so there's a lot of shortage of oxygen during the COVID-19 pandemic. Cylinders have to be used. Apollo Hospital was the first one to use it during the COVID-19 waves. And then you can have barriers to anticipation. And what kind of barriers? Even while anticipating, also there are certain barriers. Okay, not that you can anticipate anything and everything. So first of all, lack of data infrastructure. So in order to know these tools, in order to know what is the SWOT analysis, what is the spectral analysis, okay, first of all, you should have some data with you. So that is lack of data itself is another barrier. Second is inertia. And as well, all know leadership inertia is there. So because of leadership inertia, some of the hospitals are backtracking. They don't know where to go, where their hospital will be after 5 years. So leadership inertia is something which they have to overcome. Next is budget constraints, which obviously in smaller towns they are not able to compete and become successful. The larger hospitals are more seen to be more profitable. The budget constraints are there facing as a barrier, which they cannot suddenly influence and buy some newer application and suddenly start training all the people, or they cannot recruit a newer skill staff. So these are another kind of barriers which everybody faces, which is a reality which cannot run away from, which you have to face. So budget constraint. The next is silo departments. Okay, everything is moving slow. There's a disconnect between different departments. There's less of coordination, cooperation between different departments. There's a siloed department. There's nothing moving every now and then. So people have to face these kind of barriers, and we should know what kind of barriers while anticipating the changes which you have seen previously. So anticipating the changes, tools for anticipating we already covered: environmental scanning, SWOT analysis, scenario planning, predictive analytics, benchmarking. It's all nice to say in a classroom and listen to it very nicely. But when it comes to anticipating the barrier, there comes the challenge. For example, a mid-tier hospital in Pune overcome data silos. Yeah, so there are a lot of lagging behind in terms of documentation. They overcame this data silos by integrating the dashboards across all the units. The dashboard has to be same for all the hospitals together. The dashboard should look the same, it should appear the same, it should work the same, the functionality has to be the same. So mid-tier hospital in Pune overcame these data silos by integrating dashboard across all the units. So that's how we have been able to see the hindrances. Then we should also have the strategies on how to beat the competitor to anticipate the change. First of all, data-driven decision making. It cannot be intuitive decision making, or just because your boss says it's good, you cannot do. Everything has to be factual. So it should be data driven decision making. Second, scenario planning. Okay, so it takes a lot of energy, time, effort, commitment, dedication in order to know what is scenario, in what scenario we're working. Next comes your stakeholder feedback loops. Okay, all people have to collect the feedback. It's not just for the sake of collecting the feedback, but you should know, you should work upon what feedbacks you already collected. Next is workforce upskilling, so which is very important. So multi-skilling is also one of them. And next, innovation, which has to go hand in hand, not only in terms of technology but also regulatory practices, understanding demographics, on all that what we have seen previously, adaptation and skill upskilling. So all these upskilling and innovation partnerships has to always be used for the betterment. The best in case was Fortis, which tied up with IBM Watson. So Fortis partnered with IBM Watson helped to pilot the predictive patient flow modeling. So the best in case point example will always be the will be striving for to meet certain standards. But the leftover hospitals may not be able to do the same because of scarcity of money, as we all know. So IBM Watson cannot be bought by every small hospital. But then Fortis has been able to do that. Then adopting change in healthcare. So what we actually know by adoption is adopting means implementing the prepared change into the daily practice. Okay, day to day, minor, no matter how much negligible, how much incremental, how much slow, but little bit of change on a day to day basis. So who did it? Apollo integrated healthcare platforms in cardiology department and oncology, achieving 90% clinician compliance in 3 months. Okay, so they were able to meet in these departments in 3 months. So adopting change is not all that easy. Suddenly, only one or two departments, entire hospital cannot adopt change suddenly. It has to happen in stages. It has to happen smoothly. It has to happen in incremental way, slowly. So adopting change in healthcare is daily practice. In little by little, they are going to adopt. So coming to the last part, as we all move, what all it gives. First, all this has to go a long way in order to ensure improvement in patient outcomes. Second, it should support the compliance for external bodies. Third, it should improve the efficiency. Fourth, it fosters the innovation. And fifth, ensures the readiness for public health needs. So this brings to the end of my presentation. If you got any questions, please type in the chat box.